Let's now turn to other stories. As Nigeria joins the rest of the world to mark the International Day Against Drug Abuse, the World Drug Report 2024, launched by the United Nations Office on Drugs and Crime, says the emergence of new synthetic opioids and a record supply and demand of other drugs has led to a rise in drug use disorders and environmental harms. The report also explained that the number of people who used drugs has risen to 292 million in 2022, a 20% increase over 10 years. Cannabis remains the most widely used drug worldwide, followed by opioids, amphetamines, cocaine, and ecstasy. The report further states that although an estimated 64 million people worldwide suffer from drug use disorders, only 1 in 11 is in treatment. I have joining me the team lead, Drug Demand Reduction of the United Nations Office on Drugs and Crime, Akani Domo Ibanga, and he's a doctor. Thank you so much for joining us.
Thank you.
So I wanted us to talk extensively or a little more on this report by UNODC. Talk to us about, because we understand that there is now an emergence of a new synthetic opioid. Talk to us more on that.
Well, I think what we should really think about is the fact that you will continue to have new drugs in the market, things that people will go after to make them high. And what we're seeing in the recent times is that people are mixing the different things that they're taking. So they're not just taking one substance, but they're taking a collection of substances. And what the healthcare professionals are seeing is that it's no longer just cannabis, it's no longer just cocaine, but it's a mixture of a number of different drugs that different people are taking. And this poses challenges in terms of what to do to address, in terms of working out treatment plans, and in terms of how to program things that would target these new psychoactive substances that exist.
And what is more alarming to me in this report is that with all of the efforts being made to tackle this particular problem, especially even in Nigeria here, we see that the number of people using drugs has now risen to 292 million. One would have thought that it would go down with all of the efforts. What is the challenge? Is it that these cartels are getting smarter, or that we're not evolving our policies and methods?
Well, you must look at it in two ways. First of all, when you look at countries that are able to invest heavily into supply reduction, as well as track whatever programs they're doing and how this is impacting the drug market, you find, for instance, like the US, they've increased in terms of the amount of money that they're spending in supply reduction. But with that amount of money that they're spending, they're finding that the drugs on the market are getting cheaper and they're getting purer, which you find is an oxymoron. That's not the expectation. But you cannot, based on that, say that you will not have efforts that will attempt to remove the drugs from the market or from the streets. You must have those efforts balanced with efforts in drug demand reduction, where you're evolving and engaging in prevention, as well as treatment and harm reduction for those that are actually using and experiencing problems with their use.
So it is not just enough to tackle the supply angle. The demand reduction also has to be one of the policies that should be evolved. What more needs to be done, especially in terms of getting those who are demanding these drugs to see that it is a problem and then get help? Because the number of people also getting help is also quite low.
Well, the issue, I mean, when you look at... Yeah, when you look at it in terms of the Nigerian situation, it is peculiar because we don't have treatment centers that even begin to address the needs of the people. In the 2018 survey that was carried out, it was estimated that about 3 million people had or would be classified as having drug use disorder. If you say that 40% of them are actively seeking treatment, you're talking in the region of 600,000. Currently, all the facilities we have in the country can maximally treat about 10,000 in a year. That means we're not even scratching the surface in terms of the needs of people that want to use these services. So one thing we need to do in terms of, balancing that approach for our supply reduction is begin to have, make treatment centers available, both in the, in rural areas as well as in the urban areas. So anybody that wants treatment can get it just as easy as this is get treatment for malaria. So these are things that we need to invest in to make, to address the demand side.
This is a huge
the other thing that we need to do in terms of addressing the demand side is to reduce or engage heavily in prevention. And that is the theme of this year's World Drug Day. The impact is clear for us to invest in prevention.
Now, I was saying earlier that this is a huge challenge. Hopefully, the UNODC and NELA and other agencies get the help and partnership that they require. Thank you so much for your time. Dr.
It is a huge problem for us in the country, considering the population that we have, and it's a large youth population.
Right. The team lead drug demand reduction of the United Nations Office in Drugs and Crime. Thank you for your time. There is a delay there, so that's why we're having this challenge. All right, still ahead on TVC News at 7, and Nabikanu